Working on the front lines of this pandemic can mean risking infection every day. And for a nurse who grew up in Hampton, that risk turned into a positive test this week. John Shumway is live on the north side with more. John.
Ken, I've known Susie Carl since she was a young girl, she and her family, and she did grow up in Hampton, became a nurse, went on to spend time with the U.S. Navy, traveling the world as a nurse, then came out and went into private hospital outside Washington, D.C., where she specializes in hospice, keeping those comfortable who've been dying of the virus, and now she has it too.
How are you feeling?
Not great. I've had the symptoms like really come in waves throughout the day. Nighttime for some reason is the worst.
Working daily with COVID-19 patients, nurse Susie Carl says she was exposed while working with a dying man last Wednesday. She was wearing a hardware store mask and a face shield.
He started coughing. And it didn't occur to me till after the fact that I probably should have turned away because he's a dying man, and I leaned in to comfort him.
2 days later, the symptoms started, and 5 days later,
the wave hit me.
The next day she got tested, but knew even without the results that she was COVID positive. She has a machine to check her oxygen levels when her chest gets tight and it's hard to breathe.
So even when it feels like I'm not getting enough air, I have that validation that my oxygen levels are fine, and it's scary.
Susie Carl works in the hospice unit at her hospital and more than a month ago accepted that she was going to get sick because she and her colleagues simply don't have the protective equipment they need. And she worries about the other nurses.
The hospice and palliative team is not that big, and every one of them got exposed from me. That's a horrible feeling.
Recovering at home, she's staying in touch with family through technology, misses her niece and nephew hugs, and knows she's worrying her parents.
Of course I crave a hug from my mom, and every day she keeps asking if she can come down, and I have to keep telling her no.
Medically, what is your prognosis and timeline?
Yeah, so my risk of complication is incredibly low, so I know I'm going to be fine.
Yeah, in fact, she hopes to turn the corner on her battle with COVID-19 here in the next few days and says it's not out of the possibility she might be back at work as early as next Tuesday. You can see my entire interview with nurse Susie Carl tonight at 8 on CBS in Pittsburgh. Live on the north side, John Shumway, KDKA News.